Hey everybody, it's Dave. Wanted to check in. I understand there are still a couple of crew members who are struggling with the blood administration power tool when we administer our whole blood product to a patient, and getting our PCRs to validate up to 100% using our close call rules to ensure PCR completeness. So once you have your crew set up, make sure that everything is synced from the server with ImageTrend. That should happen at the start of your shift. But if you want to double check, you can always go to settings and select sync all resources. And that will make sure that all of your rules, resources, frequently transported patients, things like that, are synced locally to your tablet before you go into your PCR. So I've already built out this PCR for us to take a look at. You can see it's already at 100% validation. So I've already entered all the patient demographic information, all the times, mileages. So demographics, obviously for a patient who we are going to be giving medications to, we need a name, we need a date of birth, so we get an age. Otherwise, you can give an approximate age if you don't have an exact date of birth. And then you are going to need to enter a weight for your patient because per our COGS, we do have to have a weight anytime we give medications to a patient. And then you're also going to have to enter in some history, some medications, and if they have any known medication allergies. And then you can see I filled out the rest of this chart just to get us blue across the board, so that I could show you that it does validate. Okay, so when you are going to administer blood to a patient using the power tools, so we're going to go all the way down to the bottom right hand corner where it says all. It has the three dots. We're going to click all. It's going to bring up the power tools menu, and we're going to click the blood administration button, which is right here in the bottom row with a little blood bag hanging, and it's going to bring up the blood administration power tool. And it will automatically timestamp it at the time at which you clicked the power tool button. So you see right away we have a red error in our timeline, and that's going to be because our time is after patient drop-off. So if I pick patient arrival and then advance it a couple minutes, we're going to be able to get rid of that error. We need to give it a route. We need to say we gave 1 unit via blood warmer. We need to say what unit number. We need our donor number. It needs an expiration date. It's usually 5 or 6 days in the future, sometimes 10 days. It's always going to be whole blood, O positive. You need to say the indication, and you can have multiple indications for your blood product. If you click more, it will show you all of the indications available. Time initiated is required, time completed is not. So let's say time initiated, patient arrival, let's see, 1826, there we go. We want to see a temperature pre-administration. If you complete it, we want a post-administration temperature. And then you see down here we have, here's our red exclamation point that's giving us an error. medication administered route, so we're intravenous. And you see on that timeline button on the right-hand side, our error went away. And it's automatically pulling the roll for the medication and the administration of the procedure from the crew member up at the top. So the power tool is doing 3 things for you. If you look, we have the medication administration, and then the route of administration. So it's 3 different things. If we say okay and go look in the timeline, we have, it's medication given, procedure, and then blood products. Sorry, I misspoke. So it's 3 separate lines on your timeline, and that power tool enters all 3 of them at the same time. And as long as you clear all of those red exclamation points out of your power tool and enter them correctly, your PCR will validate for your blood administration. And then as long as everything else is validated in your run, you won't have any problems validating your PCR. If you have any trouble with it, or if you forget where to find that blood administration power tool, again, we go to all and then blood admin, and that is where you find the blood administration power tool. That is the only way to log administering whole blood. Do not log it simply as a medication, because we are unable to completely track every blood administration on the back end of ImageTrend if you do it that way. And then we don't get appropriate credit for it, and we can't track stats that way, and we don't get to brag on everybody doing the amazing things that we do. So if you have any questions about any of that, get with your captain, shoot me an email or a text, and I'll be happy to help. And hope you have a great day, and stay safe out there. Thanks for everything that you do to make this an awesome place to work.